Welcome to the Lovers Lounge podcast, where we talk to experts and other guests on topics related to love, relationships, and sex. I am your host, Tina Love, and on this episode, we have Dr. Aaron Spitz. Dr. Spitz is a urologist. He has expertise in the treatment of male infertility and sexual dysfunction. Dr. Spitz currently directs the Center of Male Reproductive Medicine and Surgery at Orange County Urology in Laguna Hills and Mission Viejo, California. How'd I do, Dr. Spitz?
You did great. Thank you very much for that nice introduction.
Thank you, and thank you so much for being on the show. So we are going to really have some interesting conversation on this episode.
Oh, I hope so.
Yeah, because you have a book, and if you can just tell me the name of your book and what you discuss.
Well, it's called The Penis Book,
Mm-hmm.
and it's a doctor's guide to the penis, from size to function and everything in between. And I'm the doctor, and it's my guide to the public. And this is a book that you can really judge by the cover.
Okay.
It's pretty much about what it says, and it covers everything from normal function to myths to actual diseases and actual treatments. And it's a book for anybody from, I would say 12 to 100 in age, the language it's written.
Yeah.
And it's obviously for men, but it's also very much a great resource for women as well.
Right. So many interesting topics. And so I am particularly interested in helping to educate my audience, whether they are men or women, to know a little bit more about penile health. So more than likely, we'll get into some things about sexual dysfunction. But of course, if we run out of time, maybe perhaps I can have you come back and we can talk about some other things. But
yeah, sure.
Yeah. But the main thing I want to discuss today is erectile dysfunction. We'll talk about that. And again, like if we have more time, we can cover some other things that are in your book, perhaps. So
yeah, no, that would be great. Well, erectile dysfunction is certainly a very well-known issue. It's something that kind of came out of the shadows once Viagra hit the scene.
Right.
Thanks due to the fact that Viagra worked for so many people, and so now there was a treatment option that could be offered to people, so there was more to talk about. It used to be that with less options for treatment, a lot of doctors had a don't ask, don't tell approach to it. And once we had something that we could offer much more easily, we talked about it more. And then also there was the marketing side. So Pfizer and the other drug companies that make these medications made the public perhaps even more aware of it than they wanted to be.
Right.
With the endless barrage of ads about ED. But yeah, erectile dysfunction is a topic that I think is still worth talking about, because it's still a topic that is surrounded by a lot of mystery and some confusion, and also even some bad information. But it's something that we could clarify here tonight.
Great. Okay, so now in my research, as I was taking a look at some of your work and reading about your book, I haven't had a chance to actually read your book, but I read it. I was just reading some things about your book and listening to some interviews that you've done. It was very interesting to hear the number one question that, when men come to you, what they're concerned about. So can you kind of help share with me, what is that number one question that men are most concerned about when they're coming to see you?
Well, I think you might be referring to a concern about their size.
Yes, that's what you said. Yeah.
Yeah. So it is, it's pretty remarkable how many men think that they are smaller than normal,
Hmm.
and how many men uh, even go so far as to apologize about their
Oh my
size,
goodness.
when I'm
Yeah.
examining them.
Wow.
And these men are all normal in size. It's just that they don't have a frame of reference the way I do, because they're the 10th or the 20th or the 30th penis I've looked at that day. So I have a lot of frame of reference.
Right.
Plus, I also know what the actual formal scientific studies say about it. But your average guy is going to have very little exposure to other penises, and the other penises he does have exposure to are probably disproportionately going to be in the form of pornography,
Yes.
which are not normal penises by and large. That's
Um,
why they are in pornography.
Right.
And
They're
so
selected because of that, right?
that,
Yeah.
that's right. So that's kind of like wondering if you are physically fit by comparing yourself exclusively to NBA basketball players. You'll come to the conclusion that you are in miserable shape because
Right.
you think that is
Is
the
the
normal.
norm. Yeah. Yeah.
And so that's but this is a common concern. Of course, not all men have this concern, but lots and lots of men have this concern. And for the majority of men, it's a casual concern.
Yeah.
But for a small percentage of men, it is a devastatingly serious concern when it should not be. But it can really become consuming and overwhelming, and
Yeah.
that's a small subset of guys who have what's called penis dysmorphic syndrome, where they really think that they have a serious problem and are unconvinced by
Wow.
just general information, kind of like people who have other body dysmorphic syndromes such as anorexia, where it really becomes an overwhelming problem. But even so, for the people for whom it's a casual concern, it's an unnecessary strain. It's an unnecessary stress on their lives, on their
Right.
well-being, and it doesn't need to be.
Oh my
And
gosh.
so I think with education, this is one less item that we have to have clouding our consciousness and interfering with our ability to be self-content, and also our ability to relate in a healthy, happy way to our partners.
Yeah, I was kind of surprised when I heard it. I just didn't even think of that as being
Yeah,
a stressor for men, because I'm a woman and all I think
sure,
about is what stressors are for us. And we're concerned
right,
about, or is my belly too big, or, when
yeah,
somebody looks at me and whatnot. But gosh, I could just imagine then if that's a big stressor for men, then they're probably really afraid sometimes when they are maybe in position and they're with their partner or a new partner or whatever. Perhaps
oh
they're
yeah,
concerned with how they're being perceived as far as their penis size. So that was an eye opener for me. So I wanted to make sure that you touched on that.
yeah,
I didn't expect that to be the number one
that's right.
concern. Yeah. But then something else though that I was expecting is the fact that going to the doctor is huge for men. Like I think a lot of them, they don't even really like to go to the doctor just for a cold, okay, a common cold, let alone to come and discuss an issue with their penis. Can you share a little bit more about that? Am I correct in that?
Yeah, you're absolutely right. And what what we have come to learn is that the majority of men will go to the internet first
Mm-hmm.
before they'll go to the doctor about concerns regarding their sexual health,
Mm-hmm.
because of that barrier, that barrier to entry that is so kind of paralyzing, because it's a taboo subject. It's a source of a lot of shaming and
Yeah.
embarrassment because of our cultural attitudes and our cultural taboos and our mythologies. And it does take a lot, and in many cases, men are uh, dragged to the doctor by their partners.
Yeah. Yeah. Yeah.
um, but I think that there has been a lot of good that has been done by the expanding of the conversation around erectile dysfunction ever since Viagra came out,
Right.
to facilitate men coming in a lot more of their own volition. But when they come in and they sit down with me, even if they've come in of their own will, so often the conversations are halting and hesitant
Right.
and fumbling until they finally realize that I'm there to help them.
Yeah. And that it's safe
and
enough to
and I'm
talk
not.
about. Yeah.
Yeah. And
Right.
then once that realization sets in, then we move from shame to relief, and then from relief to actual enthusiasm. Like, hey, great! There's something that might work. Let's see how this works. This
Wow.
is exciting.
Yeah. Yeah. Okay. So let's talk about, we said we were going to talk about erectile dysfunction. So I want to dive right into that.
Yeah.
Exactly what it is. Why don't you just kind of share with our audience what ED is exactly?
So erectile dysfunction is the inability for a guy to either get an erection or keep an erection long enough for satisfactory sex, completing sex, reaching climax, in a way that's satisfactory to he and his partner. Erectile dysfunction is a separate entity from some other sexual problems or challenges, even though it can be related in some ways. So, for example, erectile dysfunction is not low testosterone,
Okay.
but low testosterone can be a cause of erectile dysfunction.
Hmm.
Erectile dysfunction is not premature ejaculation, but premature ejaculation can, of course, lead to a problem with having a long enough lasting erection, because after you ejaculate, you lose your erection.
Right.
And erectile dysfunction is not Peyronie's disease, which is a bent erection, but people with Peyronie's disease can have more difficulty getting erections and have erectile dysfunction from that. Erectile dysfunction is about the erection itself, the ability to have it or to keep it. And erectile dysfunction has several different causes, but the most common cause depends on kind of the age group. So in men that are, say, in their 50s and older,
Okay.
the most common cause as they move through that age spectrum from 50 to 60 to 70 to 80 is going to be a physical cause, and it's most likely going to be a problem with blood flow, how healthy the flow of blood is through their arteries in their body and to their penis. And in younger guys, 20s, 30s, the most common cause is going to be what we call psychological or behavioral.
Okay.
It's going to be what we call performance anxiety. And what that situation is there's some kind of a stress, some kind of a thought trigger that makes them anxious in some way or another, so that they release adrenaline. Adrenaline is a real chemical. It's a real molecule in our body that does real things,
Mm-hmm.
but it can be released from a thought or from a situation. But that real chemical of adrenaline has a real effect on the blood vessels going to the penis, and it clamps them down. It slows down or shuts off the flow of blood into the
Okay.
penis
Okay.
and causes erectile dysfunction. So it's a physical thing that happens to the penis from a psychological trigger, and the mediator, the messenger of that thing is this chemical called adrenaline that we
Okay.
release.
All right. So could a psychological example be, kind of going back to what we were discussing earlier about, if there's a person who is very stressed over their size or their perceived size, or they think that they are very small. So because they're so nervous about it, could that be a reason for maybe erectile dysfunction, if they're just very nervous about it and that adrenaline happening might make it difficult? Is that an example of what could happen?
That is an example, and I'll tell you that that's not actually the most common cause, though. The most common cause is much more insidious, and much
Okay.
more simple. But yes, if you are stressed out or concerned about your adequacy
Right.
as a lover, you may release adrenaline and short circuit your ability to perform.
Okay.
Um, but the most common cause and most insidious cause is you may have a sexual encounter in which something is off. Maybe you have a cold, okay, or
Hmm.
maybe you're
Okay.
overtired, or you drink too much, or whatever it is. You may not even be able to know what it is, but something happens and you're a little bit off that night, and you have trouble, and you lose your erection, or you have trouble getting the erection. Well, what can happen is the next time you go to have sex, the thought pops into your mind, man, I wonder if I'm going to have trouble having an erection
Right.
like
Okay.
I did that last time. And is there something wrong with me?
Oh,
Do I have something wrong with me?
yeah.
And that thought causes you to release adrenaline. It's just that simple thought. I
I
wonder
see.
if I'm going to have trouble.
Oh,
And
okay.
then you release adrenaline, and then you have trouble again. And now you have two in a row. And then the next time, the third time, you go, I
Oh,
wonder if I'm going to have trouble having erection like I did those last two times.
yeah.
And now you release even adrenaline because the stakes are even higher.
Oh my
The
God.
situation seems so much more obviously that there must be something wrong with you physically, and you get into this vicious loop of this sort of um, you know negative reinforcement. And this is the most common cause of performance anxiety. And when I discuss this with my patients in that age group where it's likely performance anxiety, their eyes just light up and they start nodding.
Yeah.
They're
Like,
like, yes, yes, that's exactly what's happening. And knowing that can really help.
okay.
However, it may not be enough because it's hard to tell yourself not to think something, right?
Right.
If you say, don't think of the color red, you're immediately going to think of the color
Right.
red.
Exactly.
But for many guys, having that kind of explanation and confirmation does help them let it go
Okay.
and does give them relief because they come to me very concerned that they have some kind of serious problem, maybe an unfixable problem,
Right.
when it's really a simple issue of adrenaline,
Okay.
and that can help them let it go.
Okay. Now, what about medications, Dr. Spitz? What about antidepressant medications? Are they known to cause problems with erectile dysfunction or erectile function?
Yeah, so certain medications can cause erection problems.
Yeah.
I mentioned the two most common causes in different age groups,
Right.
but there are a variety of other causes across the age spectrum. And younger men and older men can suffer the side effects of medications. Antidepressants
Yes.
can cause a decrease in sexual desire and also some problems with getting erections, therefore. And the most popular antidepressants, which are called serotonin reuptake inhibitors or selective serotonin reuptake inhibitors, such as Prozac, Paxil, can have this side effect. And even though they're very important and really excellent medications for people who require them, they do cause a side effect in some of these people.
Right.
They also can make it harder to reach sexual climax. And in fact, it's that very side effect that we harness to treat men with premature ejaculation by giving them low doses of
Hmm.
these same medications to help them last longer
I see.
before they reach a climax.
Okay.
There are certain medications for high blood pressure that have known effect on erections, contributing to problems with erections. And these blood pressure medications are mainly the ones called beta blockers or hydrochlorothiazide, which is a diuretic. Those are the two most impactful blood pressure medications. There are other blood pressure medications that don't really have much of a negative effect on erections. And if a guy has high blood pressure, he's got a higher risk of having erection problems. So it's a good idea for him to manage his high blood pressure, keep his blood pressure normal with appropriate medications to have an improvement in his ability to have erections.
Right. And I'm glad you
And
mentioned the. Oh, I'm sorry.
and then I was going to say there are medications that a small percentage of men may require for treatments such as prostate cancer, advanced prostate cancer, that are hormonal medications.
Okay.
And these medications work by suppressing, shutting off testosterone to cause prostate cancer to go into remission. But by shutting off testosterone, it takes away the sexual desire and the ability to have erections.
Okay.
So these are some of the different medications that are most commonly going to give erection side effects.
But there are things that you can do to reverse it, because I know you mentioned a little bit about, you know, doing the opposite and maybe helping the situation. So with all of those things, I mean, can you turn this around? Say, for instance, if someone is taking Paxil or, you know, all these different medications, can you, is there hope for them to turn it around and be able to improve their sexual desire and their erectile function?
Yes. So
Okay.
a psychiatrist, a doctor who's prescribing these mood altering medications that the patient needs can try alternative medications in different classes, or different medications in the same class that has a lower incidence of that side effect. And so there is room, there's flexibility to work with different medications to still treat the depression and have less of a sexual side effect.
Okay.
Same with blood pressure medications. They can be manipulated, they can be changed around. But even if they can't be, or even if that doesn't ultimately provide success, the medications that improve erections that we've talked about, like Viagra, Cialis, Dendra, Levitra, the generic names we're getting more familiar with now that some of these have gone generic, sildenafil, tadalafil. These medications can be prescribed to help a person have better erections, even though he may be on medications that affects his erection. So if I have to be on a medication for my blood pressure that's making my erections weaker, I can still take a erection pill,
Okay.
like Viagra, and have good erections.
Great.
Same with the antidepressants. I can still take these medications to allow me to have better erections, in addition to the medications I require that are giving me side effects and restore my sexual function.
Okay, great. And I'm sure we're going to get into that a little bit more and maybe even some other alternatives. But something else, as I was doing my research on you and listening to your interviews previously, you talked about how the penis is actually a very good indicator of overall men's health. Can you elaborate on that?
Yeah. So probably the most obvious measure of your health is your cardiovascular health, right? How good is your heart pumping, and how good is the blood flowing through your blood vessels? Because that is what feeds all of our tissues, and when we are in good shape, we are in good cardiovascular shape.
Mm-hmm.
And the penis is pretty much mostly blood vessels, okay? And its function of getting erect is a result of an increase in blood flow into blood vessels that have to be very supple and able to expand and fill with blood, and then seal off the drainage by having very good, healthy, supple tissues. And so the function of the penis, the ability to have erections, is really a very direct reflection of the health of cardiovascular system, the blood vessels, and the heart health.
Mm-hmm.
And so if you're having trouble with your erections, odds are, unless it's one of these psychological situations in a young guy, when you're in your 40s, 50s, 60s, and beyond, if you're having trouble with your erections, odds are it's a reflection of your overall level of cardiovascular health.
I see.
And what is good for your heart and your blood vessels, eating well, exercise, reducing stress, sleep, all these things is also what's good for your erections. And what you can do to restore your cardiovascular health is also what you can do to restore your erections or to prevent yourself from getting erection problems as you prevent yourself from getting cardiovascular disease.
Okay. So I guess I'm kind of it's going through my mind different types of health conditions. So maybe like high blood pressure. Could diabetes also be something that could affect a person's erectile function?
Yes. So diabetes, high blood pressure, obesity,
Mm-hmm.
these are all conditions that have negative effects on the blood vessels and the heart.
Okay.
And therefore, they all have negative effects on erections. Diabetes causes the smaller blood vessels in your body to clog up and to fibrose because it directly damages the cells that make up the lining of these blood vessels. It also injures the smaller nerves in your body, such as the nerves in the penis and the
Okay.
nerves that trigger the blood flow to increase into the penis. And so diabetes is a double hit. It's hurting the
Wow.
blood vessels and it's hurting the nerves.
Mm-hmm.
High blood pressure is going to hurt the blood vessels, particularly the smaller blood vessels, making them harder and thicker and narrower. And obesity, which plays into what we call the metabolic syndrome, gives you a higher risk of high blood pressure and of diabetes.
Right.
And all that excess fat releases a lot of free radicals and toxic molecules into your bloodstream that's no good for your blood vessels as well. And so these different diseases, these different medical conditions, chronic disease states, are putting wear and tear on the blood vessels to your penis, making them narrower, less supple, decreasing the blood flow. And these kinds of chronic health conditions can be cured or improved or reversed by your own diet and health behavior.
Right.
In many cases, I mean, there are some people who have genetic predispositions to these, but for, I would say, the clear majority of people, these disease states are really the result of choices they're making with what they choose to put in their mouth and whether or not they choose to smoke or exercise. And these are simple decisions that they can make and unmake.
Right.
And so a guy who's got erectile dysfunction, because he has high blood pressure, obesity, and diabetes due to choices he's been making with his diet and his lifestyle, also has the ability to reverse it and to turn it back.
Okay. Yeah. And it's interesting because you just mentioned smoking. So if a person has high blood pressure and they are smoking cigarettes, cigars, whatever, can that then make it even more of a challenge for their erectile function? Is that what I'm hearing?
Yes, because smoking causes hardening of the arteries, which means the arteries become stiffer and more narrow and decrease the flow of blood through them and decrease the flow of blood to the penis.
Right.
So smoking is a well-known cause for erectile dysfunction. Add that to high blood pressure, it's a double hit. Throw in some diabetes, it's a triple threat.
My gosh.
Add some obesity, and you're boxed in. You
My goodness.
give it
Yeah.
up.
Yeah. Yeah.
So, yeah,
Now,
absolutely.
you've talked about a little bit. You just kind of touched on what a person is eating. So I want to get into that because I don't know, maybe you have heard some of the different studies out recently. I saw some things as I was looking into you and on turning to a plant-based diet for men and how that can be helpful, or just meat, perhaps eliminating some of the red meat and different kinds of meat that can also be helpful in reversing erectile dysfunction. Have you heard of any of those studies and anything to that?
Yeah. So diet is critical to our health in many ways, and there have been a lot of studies looking at the association of various kinds of foods and various diseases. From heart disease to cancer and bowel conditions, autoimmune conditions, etc. And dietary science is tricky. At one point in time, there will be a declaration that one kind of food is very, very good for you, and you should eat as much of it as you can. And then another declaration will come out and say, "Oh, we were wrong about that. You should avoid that kind of food and instead eat this kind of food."
Right.
And we've seen that kind of flip-flopping over the decades with carbohydrates and with fats. And now more recently, we're seeing it with protein.
Yeah.
But the one kind of food that has never been flip-flopped on, that has never been recalled, is vegetables.
Yeah.
We've yet to have scientists come out and say, "Hey, everybody, we were wrong. Don't eat your vegetables."
Right. Right.
Okay. And the same can be said for fruits as well, fruits and vegetables, basically plant-based foods, whole foods that are plant-based, which is fruits, vegetables, nuts, that kind of thing, really are not very controversial, that they're good for you. And when you look at the science and the studies, although there's always ways to find controversy and there's always ways to cast doubt. If you look on balance, really, at the large number of studies that are out there about nutritional science, you will find again and again that people who are eating a plant-based diet or more of a plant-based diet than the other group that was being studied have better health outcomes, especially and including with regards to their cardiovascular health, with the health of their blood vessels,
Right.
which relates directly to the health of their erections. And when you look at studies that are specifically about erections and men's sexual function, and they compare groups of patients who have erectile dysfunction that are eating more or less fruits and vegetables, those that are eating more fruits and vegetables have less erection problems or are able to improve their erections better, even if they already have diabetes, even if they already have high blood pressure. Plant-based diet has been shown to improve erections, and it's also been shown to improve cardiovascular health. And it's not very controversial, and it's pretty straightforward and simple.
Wow.
And so I do recommend a plant-based diet to my patients. Now, when you get into things like meat, red meat, fish, chicken, there again, I think it's best to keep it simple. And I would recommend that minimizing animal products, whether it's red meat, whether it's white meat, whether it's eggs and milk, or whether it's fish, minimizing animal products as a group is a good strategy.
Okay.
And even very recently, this past month, in February, a study came out of China. I think it was about 30,000 patients, where they were able to correlate heart disease with not fat, not carbohydrates, but with amino acids. Amino acids are the building blocks of protein.
Okay.
Amino acids that were high in sulfur, or that were sulfur-containing, I should say, sulfur-containing amino acids. And those sulfur-containing amino acids are found in much higher amounts in animal protein than they are in plant-based protein. And the conclusion of the study was that it's better to eat a plant-based diet to lower your risk of heart disease.
Wow.
Because of the protein. And this kind of protein, this animal protein, is not red meat. It's red meat, it's white meat, it's fish and eggs. It's animal protein, not just red meat.
Okay. All right. Period. Okay. All right. Well, I want to shift gears a little bit. Well, not really, because we did talk about the medications that you can use or that you can prescribe anyway, to
Yeah,
treat erectile dysfunction. And so you mentioned some of them. And
right.
say, for instance, those medications do not work. I mean, are there instances where someone could use those medications and they might not work for them? And so afterwards, where do you go next?
Yeah, so that's a great point because one of my colleagues said years ago after Viagra came out, the only thing worse than not treating, not getting treatment for erectile dysfunction is getting treatment for erectile dysfunction and it doesn't work.
Right.
Then it's very frustrating.
Yeah.
And in fact, the pills only work in about 65% of people. So there's about 35% of people for whom pills do not work.
Right.
And the reason for that is that their underlying vascular condition or their underlying nerve condition, because it does take nerves too for the erection to work, is just too severe for the pills to be able to overcome it. Now, the strategies for that are one, if you've got a condition that you can reverse and improve with diet and exercise, you could get your tissues healthy enough to where the pills do work for you.
Okay.
You could bring things back from the brink where the pills actually work well for you by getting healthier. And that may take a year or two, but it certainly could be worthwhile. On the other hand, you may need a stronger, more effective remedy than what the pills can offer, and that is available. So one of those remedies is a injection with a very tiny needle, kind of like what a diabetic person would use to inject insulin in themselves, this very tiny needle.
Okay.
Injecting a very small amount of medication directly into the penis through the skin and into the shaft on the side of the penis where there's not a lot of nerve. So it's not very painful to do this.
Okay.
Or administering a similar kind of medication in the gel form or a pellet form into the opening of the penis. But these are medications that are going just into the penis. You're not swallowing them. They're not going throughout your whole circulation. They're just going into the penis. They're a lot more potent, and they can stimulate the blood flow into the penis a lot more powerfully than the pills can.
Wow.
And for the vast majority of men for whom the pills are not strong enough, this remedy is.
It actually works. That's good.
It actually works. Now, this is the remedy that really does have the risk of, if an erection lasts more than 4 hours, seek emergency help, which you hear on the commercials for the pills, but which rarely happens with the pills, but does more often happen with this. So this kind of a medication really needs to be prescribed carefully in an individualized way by a doctor, and it is not something that a person should sort of seek out on their own. And I've run into a number of patients in the emergency room who tried it out on their own. They got it from a friend or they got it from some dubious source, and they ended up with one of those erections that lasted too long. And that can be actually very destructive to the penis after too many hours, because an erection is actually blood that's trapped in the penis no longer flowing, and it is losing its oxygen, and at some point, doesn't have any oxygen for those tissues anymore. So you don't want an erection to last too long.
I'm telling you.
And the average act of sex is about 5 to 7 minutes. I mean, people are not having marathon sessions outside of pornographic depictions.
Yeah.
So the erection is not really meant to be lasting a long, long, long time. But at any rate, that is a very powerful remedy for men for whom the pills don't work, but it's not for everybody. Another alternative is what's called a vacuum erection device.
Okay.
And this is a cylinder that is put over the penis, and a vacuum is created in the cylinder with a little mechanical or hand pump, which causes the penis to fill up with blood and get hard, because that's what an erection is. It's a penis filled with blood. And once the penis is hard, there's a little constriction band that pops off the base of the cylinder onto the base of the penis, like it's a cock ring, basically, but it's a constricting silicone band, and it traps the blood in the penis, keeping the penis hard. And the guy has sex, and when he's done, he just
Takes
pulls
it
that
off.
ring off,
Yeah.
and then the penis drains its blood back into the body and becomes soft again. And that's a very nice solution too, because there are no prescriptions involved or needles involved, and a person can use it whenever they choose. But of course, it's a different method, and it has some aspects to it that may be unappealing to some people. But there will be people for whom neither of those methods work well enough,
Oh, wow.
because their blood vessels are just not able to open up enough, even for the injection to work, or not able to trap the blood well enough, because they're not supple enough to make that seal to trap the blood in, even with the cock ring. And for these men, a penile implant surgery is an excellent solution, and will give them a good, reliable erection that is very natural looking and feeling for them. And this implant surgery does not in any way interfere with the sensation they have in their penis or their ability to ejaculate. And so, fortunately, there are solutions for even the most severe cases of erectile dysfunction. And again, not all cases of erectile dysfunction can be reversed with diet and exercise, but many can. And even more importantly, and even better, is preventing them from happening in the first place, or at least slowing down the onset of the problem.
Okay.
You might get erectile dysfunction in your 40s or 50s if you have really bad dietary habits. And if you had really good dietary habits, it might not affect you until your 70s or 80s. And wouldn't that be nice to have another 20, 30 years medication-free?
Yeah. Okay.
That's the idea.
Yeah. So I want to go back to, you were talking about the needle. You were talking about the very fine needle that can be injected into the side of the penis, and you talked about like a tablet or something that can be inserted into the
a little pellet
yes, a
or
little
gel
pellet or gel. Yeah.
that has the same ingredient, but it's put into the urethra and then absorbed through the lining of the urethra, then on into the penis chambers.
Okay. So my question about those two, first off, that sounds, I hadn't heard of that. So is that relatively new, or how long has that medication been out? Or how long have you been prescribing that? Is that something fairly new or not?
Well, the injections have been around since, I think, pretty consistently around since the 80s.
Okay.
Early 80s. And they were what was available before Viagra was available. Was medication that was available.
Okay.
The pellets came out in the 90s, and the gel is very recent.
Okay. So my other question then is about the timing of these things. So because I'm thinking about, like the Viagra and the Cialis can be taken, okay, a little bit before you're going to have sex. Okay. The needle and the pellets and all of this, the gel, how soon after using does the person, or can the person, get an erection?
It's typically about a 20-minute onset.
Okay.
Sometimes it can be a little faster, but allow about 20 minutes.
So you really have to, there's some timing there that has to be taken into consideration. And then when it's prescribed, how much of it is given to an individual? So like, with Viagra and Cialis, there's a thing of pills, right? So
right.
How, with the needle, like how many would they give a patient, or I guess the pellets too? How does that generally come? Yeah.
Yeah, sure. So the injection can come in two ways. One is in a product called Caverject, which is pre-filled syringes that have the drug in a powder form and the liquid ready to mix with it. And once you mix it, you inject it, but they're separated in these little chambers. So you can keep them for a long time, and then when you're ready to use one, you activate it, it mixes it up, and you inject it. And you can have as many of these as your insurance allows you to get it, a prescription or as much as your doctor will prescribe you and you
Right.
choose to pay for.
Yeah.
And they have a long shelf life.
Okay.
The other formulation is called trimix or bimix, which is just kind of a nickname for it's a mixture of 3 ingredients, or it's a mixture of 2 ingredients. And these formulas are made by compounding pharmacies. They're not made by a branded pharmaceutical manufacturer, the way Caverject is. And these are already mixed into the liquid form and sold in vials that the patient would draw a little bit out of at a time,
Okay.
and keep the rest of that liquid in that vial in the refrigerator.
Okay.
It needs to be refrigerated. And each time he wants to use it, he would wipe off the top with an alcohol wipe and drop a little bit into a brand new fresh syringe and needle, inject it, discard that syringe needle, but keep that vial. And the shelf life of that liquid is probably on the order of a few months. And different men will require different amounts to get the erection. So one vial might give one guy 20 uses, and it might give another guy 6 uses, depending on the severity of their condition.
Depending on how much they require. Okay.
Yeah.
And
the pellets come in little applicators, pre-packaged, and you might, depending on your prescription, you might get 3 of them, 6 of them, 8 of them, and you keep them in your refrigerator until you're going to use them.
Yeah.
And then the gel likewise is, kind of preloaded applicators that you keep in your refrigerator.
Okay. I was going to ask about affordability. Do you find that insurances tend to cover this? Is it, if they cover it, is it still pretty expensive for the patient, or what do you think? What have you heard?
Well, the injections are pretty reasonable in price, even if you had no insurance coverage at all, because it takes a very small amount of the liquid for most guys to be effective. And so, for example, you might get a 5 cc vial. 5 cc's, which is like a teaspoon, and a 5 cc vial might cost $100, and that sounds like, wow, that is really expensive. However, you might only need to inject 1/5 of a cc.
I see.
To get an erection. So that means you've got 25 doses in that vial, which means that each dose is costing you $4.
Yeah. Okay.
Now, that's not so expensive.
Not so expensive when you look at it that way. Yeah.
That's right.
All right.
Yeah.
So we've got somebody listening out there right now. They are probably somewhat relieved to hear some of the things that we've talked about. And they are contemplating perhaps maybe that they should go and see someone. They notice that this has kind of gotten in the way of their sexual performance, or them even wanting to have sex, or their relationship with their partner or their spouse. So what should they do, in helping to correct this situation? I'm sure they should call a urologist, or can you just give them some tips on what to do and what to expect?
Sure. So, the most simple, straightforward thing to do would be to tell their doctor, who they see on a regular basis, if they're having some trouble with their sexual function, they'd like help. Their doctor may start out with a prescription for them, or an evaluation of them, and then a prescription for them. Or your doctor may refer them to a urologist, who can then take it from there. Prior to going to their doctor, they might find it helpful to get some background information about their condition. And there are a variety of good sources of information that are online, not the least of which is my book. And so, my book is written for people who have curiosity, but also people who have real problems. And I have my patients, in many cases, use my book as a resource to follow along in the therapy that we're doing, to understand it better, and also to understand how to maximize how their treatment is going. So I would say the simplest approach is, walk in and tell your doctor you're having a problem, but probably a more, I think,
Specialized.
satisfactory and long-term successful approach is to get educated as well as seek help.
Okay.
I don't recommend getting educated and then trying to self-treat and self-diagnose, but I recommend getting educated so that when you are working with your doctor, you're able to collaborate. You're able to be on the team that's taking care of you.
Yeah. All right. So resist the temptation to try to treat yourself by looking at WebMD and all of that. Try to
Right.
make sure you go see your doctor and get a prescription or see a urologist or that kind of thing. Okay.
Yeah.
And your book again, let's make sure that they know what that book is and where they can get it.
Yeah. So it's called The Penis Book, A Doctor's Complete Guide to the Penis from Size to Function and Everything in Between. But just remember The Penis Book by Spitz, Aaron Spitz, that's me. And you can find it on Amazon, Barnes & Noble. It's very, very easy to find online. And you may find it in some bookstores too.
All right. Well, thank you so much, Dr. Spitz. I tell you, we took the entire, almost 50-something minutes talking about erectile dysfunction. I mean, it's something you can talk about on and on, right?
That's right.
But there's so much more in your book. And so I want to tell you already that I want to have you back on the show.
Oh, great. Thank you.
So thank you so much. Thank you so much for coming on.
Sure. Well, just let me know, when it's going to air and how to find it, and then I'll promote it across my platforms as well.
Thank you so much. Thank you, Dr. Spitz. And thank you guys for listening right now. I hope you've enjoyed listening to the Lovers Lounge podcast, where we talk to experts and other guests on topics related to love, relationships, and sex. I am your host, Tina Love. And until next time, peace. And of course, love.